Hi, everyone. This is Caroline from Fiat Integrative Health in Franklin, Tennessee, and you're listening to the Fiat Health Podcast. We believe that now more than ever, the healthcare industry has become a place of confusion. And over the years, we have been asked countless questions about what true health and integration for the whole person looks like. Join us every other week as we explore topics ranging from primary care and women's health to counseling and spiritual health. We're so glad you're here.
Hello, everyone, and welcome back to the Fiat Health Podcast. My name is Scott Weeman. I'm a marriage and family therapist here at Fiat Integrative Health, and I am joined by my coworker and fellow therapist, Lucy.
Hey there. I'm also a professional counselor here at Fiat, and we're excited to be here and talk today. Yeah, Scott, do you want to start us off just sharing a little bit about you or your work at Fiat or Fiat in general?
Yeah, gladly. It'll be almost 2 years since I've started as a therapist here at Fiat. About that same time that my family and I moved from San Diego to Nashville, Tennessee.
I can't believe it's been that long.
Same here.
Yeah.
Yeah, and enjoying time here in Middle Tennessee, as well as our time at Fiat. In addition to my work as a marriage and family therapist here, I also run an organization that I founded called Catholic in Recovery, and we provide support, fellowship for individuals and families seeking freedom from a variety of different addictions. So really nice to be able to blend the one-on-one work or, work with individuals, families, and couples here at Fiat with that kind of work. Yeah, it's been a huge blessing. How about you?
Yeah, I've been here almost 3 years and here part-time and then home with my 2 toddlers part-time. But yeah, I love it here. I love the integrative aspect of people get to come see us, but they also get to go down the hall to see the doctors and to see women's health or spiritual directors. And I love those clients of ours that we see all the time here because they're popping in and out to different people and really getting that collaborative care. But it's also fun to see the one-off people and people who are really passionate about counseling in general, or especially Christian counseling. I know in Catholic counseling, that's some of our niche here and really fun work that we do.
Mm-hmm. Lucy and I also share a love for Survivor, the television show Survivor. We're not here to do any kind of Survivor recapping, but
maybe we should, though.
Yeah, that's one hobby that we share together, one interest that we share together, which are often recapping together episodes as we watch them throughout the season.
Every Thursday morning. Did you watch last night?
Yeah. So what are we here to talk about today, Lucy?
Yeah, we are going to talk about some of the skills or things that we want our clients to leave knowing, kind of on a broader, larger scale. Yeah, I think that's such a good topic. My supervisor will often talk about her therapy arc, like the clients who have been with her over time. What's the arc that they've moved through from learning to regulate emotions to learning to set boundaries to learning to have effective relationships. So you and I are going to talk through some of the skills that we often cover in our little arcs.
Yeah. And we'll cover a broad array of skills, and many of these are worth diving further into. We'll probably just be scratching the surface on some of these items. This began as we were going to first speak about attachment styles, a topic that we will address in a future episode. And then we're thinking about perhaps some CBT, DBT, cognitive behavioral therapy, or dialectic behavioral therapy, tools, skills, and then thought, though, that we would broaden it just in general, relationship skills, communication skills. What are those things that, regardless of the modality that we're using or the kind of the style of therapy that we're doing, can be very helpful to leave our clients with? It's often, you may have heard it said that if your only tool is a hammer, everything looks like a nail. And so in that case, we need to develop some new tools, new skills to manage life, to respond to life, and to improve our relationships and ultimately our quality of life.
Yeah, definitely. Okay, when you first have someone come in, first 2 sessions, is there anything that you're hitting with most people?
Yeah, I typically, in addition to just getting to know the person well, building trust with them and letting them know that I care, I really want to kind of try to figure out early on, and this takes some time because oftentimes as trust builds, some things will come out that may not come out in a first session or 2. But really getting to the root of what are the core beliefs that this person lives their life by, which may not be as easy for someone just to declare, my core beliefs are this, this, and this. Oftentimes, it's getting to know history, family history, childhood history, their experiences growing up, may or may not include some trauma, but that perhaps those wounds that we carry are masked by these vows that we create, telling ourselves that I'm never going to do this, or I've got to be like this, or in order to be accepted in this world, I've got to present a certain way. And so sooner rather than later, I'd like to kind of try to figure out what are those core beliefs that the clients living by.
I feel like you often can start to pick up on them in history taking. They come out in these really subtle ways, sometimes so explicitly of, gosh, I felt like a failure. Gosh, I felt so responsible. But sometimes it's a lot more subtle than that. At least I am just kind of flagging them and noticing if they come up again in future sessions.
Mm-hmm.
Yeah.
And I think that sometimes we tell our story in ways that can be so matter of fact. A client coming in and sharing something that is, they'll share something that can be very sad or tragic, but speak it so matter of factly. So sometimes even just in, kind of getting to our first skill or tool is just to be able to like receive some empathy from someone. Like, wait, hold on a second. You said what? Like, wow, that sounds really impactful. And just giving that person a time to pause and sit with that emotion, which may not be an emotion, it may just be a cognition at first, because it's something that they've lived with or is just such a part of them. But to pause and say, that doesn't sound right, or I'm so sorry that happened to you, can be very impactful.
I think sometimes we get so used to telling our stories that we, numb the emotion out. And I think that's why counselors are, get the rap of saying, wait, how did that make you feel? Like, pause, there's some emotion there. And even if it's not on the surface, I also, to go hand in hand with checking in on and receive the emotion, receive the empathy, oftentimes directing people to their bodies to get clues to the emotions. Maybe the emotion isn't accessible, but you can tell you have a knot in your throat, and that's giving you a clue to the emotion that's present.
Absolutely. I mean, just like, really the mission of Fiat is to integrate our physical health, our mental and emotional health, and our spiritual health. And therapy, good therapy, those things are so hard to isolate anyways. And so being able to come to one place and receive that kind of care is so important. But as therapists as well, we're not just dealing with, our whole body, our whole being is not just, part emotion, part mental, part physical, part spiritual, but those things are so wrapped together that sometimes just understanding like what's happening when I'm feeling this way. I feel this anxiety, or I'm feeling this depression. Recognizing that that's often a thought that triggers a physical sensation in our body. Emotions can be very nebulous or ambiguous. We might feel like there's some kind of like spirit that's moving within us, but really emotions are just a body's reaction to oftentimes a cognitive thought that we might ruminate on. And so, our thoughts, our physical bodies, our emotional selves, and our spiritual selves are so interrelated and so interconnected that it's important that we bring all those things into our role as a therapist and the work that we do with clients.
Yes. I feel like we're both talking right now about different noticing skills, learning to notice our emotions, notice our bodily sensations, notice our thoughts. And I feel like that often is taking up the majority of my first few sessions with people, usually tailored to whatever they're wanting to work on. Like, okay, wait, let's learn to notice the anxious thoughts and name them. Let's learn to notice the angry thoughts or the anger. Let's notice it when it's at annoyance instead of full-blown anger. Do you have any specific skills you run through for growing ability to notice?
Yeah, I think, well, first, the work that we do in sessions with someone can be because it can be so hard as we live our day-to-day lives to recognize various things, like the fact that my body's been involuntarily breathing all day, or that I've been, thinking or having emotional responses to things throughout the day. Fear or other things can create these, just disturbances within us. And that impacts the way that we approach life. It impacts our relationships. So yeah, there's a couple different, I would say, ways to help people notice those things. I'll typically do get on the whiteboard early on and put like a ABC, the A, activating event, B, the belief, could be behavior, but I think belief. And then C, the consequence. So the activating event being, I was driving to the airport and all of a sudden I got a message that our flight was delayed or our flight is canceled. We've got to, go make some rearrangements. I was looking forward to this the belief, I was looking forward to this. Why do these things always happen to me? And the consequence being I'm miserable, my kids are miserable, I can't respond well. Whereas the same activating event, getting a message or receiving information that like a flight's delayed or some travel plans have been changed, a different belief could be, well, what a blessing it is that I have the opportunity to be together. Tomorrow we'll be in the place where we want to be rather than today. But, and so just those shifts in beliefs can then change the consequences. I'm a little bit more patient with myself, with my kids and my wife, and a little bit more adaptable. So I would say that being that there's a variety of ways to kind of integrate or show how our activating event can trigger a thought, which then has some emotional consequences, and those emotional consequences impact the way that we live our lives. But are there any particulars that you like to use to address or give people the tools and skills to at least notice what's going on within themselves?
Yeah. I also love the ABC skill. And I love doing what you just did of, okay, let's find yours belief. And then let's find what someone else's could be, because it almost brings a stark contrast to finding our own. A lot of my noticing are, yes, doing it in session first to get the practice. And I will usually also make them really describe that thought or that part of them that is speaking that thought, that anxious part, that angry part, whatever type of part, so that they really have almost a visual idea of it, of, okay, that part of you that has these anxious thoughts, if it was an inside out character, what would it look like? What does it feel like? What are the types of moments that it's coming up and getting activated? Because the more, what's the word I'm looking for, substance that we give to that part, the easier it is for them to notice it outside of session of, oh, wait, that's my inside out anxious part coming up. Let me pause. And then we get to do all the other work that we do.
Yeah, even just inviting the client. If you were to give that part a name, what would it be? Sometimes that might be like color. People have the different parts of them have different colors. We're not saying parts as in like dual, multiple personalities or things like that, but just different parts within us that are seeking our protection and well-being, but may, and based on past events, may be a little bit more or a little bit too active in our overall composition.
I always describe it as there's a part of me that wants to go to the gym and a part of me that doesn't.
Mm-hmm.
That's kind of what we're talking about with parts. Yes, I appreciate not the multiple personalities asterisk here.
Yeah. And just, I think it's so important that we can recognize these things, notice these things without acknowledging what's happening within us. It's really hard for us to have any kind of successful intervention or for our clients to, in the moment, recognize what's going on, pause, and perhaps do something different. Skills, really, these tools and skills give our clients agency. Without those skills, they're otherwise stuck in very familiar cycles. Anxiety leads to avoidance, shame leads to isolation, hurt leads to withdrawal. And, we see that whether it's an individual or a couples therapy or a family dynamic, then, other people's defenses trigger other people's defenses. And then we get into these almost death cycles that someone's got to we got to intervene within that.
Yes. I think one thing we should definitely note before moving on from noticing is there's the whole skill of noticing, and then there's almost this additional aspect of it of noticing without judging what you're noticing. I don't want my clients to go, oh my gosh, there's my anxious thought. Of course I'm anxious. Come on, Lucy, get it together. Why are you anxious right now? You're only going to get more anxious or more angry or sad or depressed. There's such a skill there of building compassion of, okay, I'm anxious, period. Interesting. Getting curious and getting kind, okay, it makes sense I'm anxious given my story, given whatever is going on around me.
Yeah, this non-judgmental curiosity of
it's
ourselves.
Hard.
And if we can, in some ways, do that with our clients, be that, kind of that third person in their lives, to be curious about them in a non-judgmental way, I think that can help to build that curiosity within clients.
Definitely. We get to be the voice for a lot of these of, wait, pause. I noticed that, an anxious thought just then. Wait, pause. That's so interesting.
I've got a number of laminated sheets that I'll bring out depending on the client's needs. One of those is a list of cognitive distortions, which we're probably all in some ways familiar with and participate in ourselves. And just to, along with the client, reading them and, seeing some of these might land, some might not, but things like all or nothing thinking or catastrophizing or taking things overly personal, or I'd say discounting the positive, minimizing the positive and overreacting to the negative. Like these are, I think, cognitive distortions that can be very helpful as well to help notice in real life when this is taking place so that we can pause and perhaps entertain a different thought.
Yes, when we have a name for it, it helps to know what to do next. How would you explain what a cognitive distortion is?
I would say that a cognitive distortion is a way, the reasoning that our minds jump to when faced with a certain situation. If someone is giving us some feedback that could be constructive feedback, we might deem it as negative critical feedback, when in reality, it's just something that can give us some helpful ways to form our lives. I mean, I see this. I've got young kids, 7, 5, and 4 years old, and my 7-year-old, sometimes when we're just trying to teach her what's right and wrong, when we're sharing, I would prefer that you not do this, or there's a reason why, we don't do this. Take it as, negative, critical, this criticism of her as a person. And so, of course, we want to be gentle with ourselves, gentle with the people that we love, gentle with our clients, but helping to see that their reaction to feedback or their reaction to situations can point them in the wrong direction. And so, the cognitive distortions are oftentimes the thoughts that we go to when faced with a certain situation or certain types of feedback.
Like our reasoning that is distorted. Yeah. Okay, what normally comes next from noticing skills?
Yeah, first, I would also say too, one of the things that I try to express to my clients, because this is something that I've had to work through early in my personal recovery and kind of emotional maturity, is you're not responsible for the first thought, but you are responsible for how long you entertain it. So that first thought might be rooted in a negative cognitive distortion. And so being able to recognize that then gives us the option of, do I continue to entertain this thought, or shall I, engage with or get deeper into a more positive, healthier thought that might be true?
I like that a lot. I think also knowing we're not responsible for that first thought helps with that compassion that we were talking about a second ago.
Mm-hmm.
Yeah.
Yeah. So then, with recognition provides opportunities to do something different. And there are a number of different skills, DBT or CBT skills or tools that we might refer to go in a different direction. That might be changing, recognizing a negative cognitive distortion, a negative thought, and then rather than ruminating on that, questioning that, is this true? And what evidence do I have to prove otherwise? What if I am taking some criticism or believing that that's like an indictment of me? Well, is that true? And what is true? Just being able to kind of question and, again, be curious. Sometimes we got to challenge ourselves in order to get into good patterns of healthy responses or healthy cognitive thoughts.
Yes. A question I've recently added to my kind of CBT toolbox for questioning cognitive distortions comes from Emily Adams from Metanoia Catholic. So shout out to her. But it's all about asking what the tone of voice of this thought is. Is this thought condemning? Is it convicting? Is it empowering? Is it shaming? And then she adds this piece of, would God talk to you in that tone of voice? And I love that. I think that's so powerful of, even if God wants me to change this thing, this isn't how he would be speaking to me about it.
Absolutely. And that internal dialogue that we have with ourselves is very consistent with what I mentioned before about what are the core beliefs that we live by. Those core beliefs will often inform the kind of dialogue that we have with ourselves throughout the day. And no one may be even privy to this kind of internal dialogue. And similarly, when someone is speaking how they kind of talk to themselves, I'll usually pause and say something akin to what you just mentioned of, you would never let anyone speak to you that way, would you?
Mm-hmm.
Nor would you ever speak to anyone else that way, would you? So why is it okay for you to speak to yourself this way? And usually that's a pretty healthy and reasonable reframe of, I can do something different here.
Yes. I think so often we expect that we need to shame or condemn ourselves into change, but there's a quote about how no one has ever successfully shamed themselves into change that I use a lot in counseling. And yes.
You mentioned CBT, cognitive behavioral therapy, which is basically just understanding that what I think affects what I feel affects what I do, and what I do often reinforces what I believe, getting to those core beliefs. And so if we can change our thinking, which is not as easy as said than done. In fact, sometimes I believe, many times, I kind of believe that we can't think our way into right action, but we have to act our way into right thinking. And so that often means, and this is kind of combining a DBT skill of an opposite action. If I'm thinking a certain way, then that's going to affect my behavior. What can I do as far as my behavior to do almost the opposite action of what I'm compelled to do, what my body and my mind and my emotions are telling me to do in this moment?
An opposite action is really helpful for moments where our thoughts don't fit the facts, or when what we're wanting to do would not actually be helpful for us, and we're able to recognize that. So there's almost this little step of what we were just talking about, questioning our thoughts, realizing this isn't actually fitting the facts, or wouldn't actually be helpful for me, and then doing this opposite action. What would an example of an opposite action be?
I would say, sometimes just doing nothing is an opposite action. So, sometimes the emotional pain that we're in can be so distressing that we feel like we need to call someone or, kind of tell them, almost make things right, say something that we otherwise wouldn't want to say, or, that can be just a relationship killer. And so sometimes the best thing to do is just take no action at all. Sit on your hands, if you will, rather than trying to meddle and get into the situation and solve everything all at once. Now, other times, maybe we're compelled to do nothing. And so the opposite action, especially if someone who is struggling with some depression or feels like they can't get out of bed, or, going on a walk would be too difficult, or, what are some things that we can do that we don't want to, I'd rather just fill myself with a bunch of unhealthy food, flour and sugar. What's the opposite action of that? That might be getting out and taking a walk, or calling someone, or, seeking someone who can provide some assurance or some support for us in the moment. Those are all opposite actions.
I went to a training on this recently, and an example they gave that I did not expect was the motion of love makes us want proximity to someone. But if that relationship is not actually healthy or helpful, or maybe it's not reciprocal and you should not be approaching it, the opposite action would be to retreat, to not create proximity, to create distance. And I did not expect that example, but I thought it really painted the picture.
Yeah, sometimes no reaction can be a healthy thing. I personally, in some family relationships, had to maintain that, I could either just send this text message right now and prove myself right, or I can be happy. I think of, you'll hear sometimes in wedding homilies, the pastor saying, you can either choose to be right or you can choose to be happy. And the recognition of that is would this further the dispute and create even just, I might feel justified for a moment, but still kind of further this anger and rage? Or can I trust that this emotional pain or this sensation will go away over some time?
Yes.
There are so many DBT skills that we could dive into. Some, stop is a very popular skill. Stop, take a step back, observe, and then proceed mindfully.
It's an acronym, yeah.
These also self-soothing opportunities, rather than seeking validation and affirmation from other people, which is a healthy thing and a healthy desire. It's not that that's a bad thing, but sometimes we can overdo that and have the need for someone else or even an external substance or behavior to soothe us. This is where addictions can begin, whether that's resorting to alcohol, drugs, food, lustful behaviors, the need for other people's acknowledgement of us. Yes, those can lead to difficulties. So being able to self-soothe, having some kind of internal mechanisms so that we don't have to look for something outside of ourselves to validate us, but have some self-validation can be very helpful.
Mm-hmm. I was just thinking this is like the one kind of broader area we hadn't hit yet. We've hit noticing skills, we've hit just a couple of the change your behavior, change your thoughts skills. But yes, like what if you're so dysregulated, so overactivated that none of that even feels accessible? These, yes, self-soothing skills.
And similarly, the way that we talk to ourselves or talk to others or talk about ourselves, I think sometimes just in the language that we use, subtle, but I think impactful. We use the term should all the time. I should have done this, or I should be doing that, or I think that subtle shift from should to could can be very helpful. Even, in session, I'll try to kind of, if I've had this discussion with clients before, I'll almost just, kind of interrupt them when they say should and just say could, just really, really quietly. And, it was informed to me by, I used to have this pattern all the time, which was just shame-provoking. A man said to me, "Scott, you're shitting all over yourself." You find something different. And even just using the term could provides, there was an opportunity for me to do something different. And perhaps in the future, I can rely on that rather than just sitting and wallowing in my shame. Rather than using the term but, using the term and. Usually when we say the term but as like a transition, it kind of negates everything that we said prior to using the term but. And so using the term and instead of but allows us to hold perhaps conflicting thoughts at one time.
That one, obviously universally applicable, but I work with a lot of moms and I feel like I'm often using that with moms. I love my kids and I need a break. Versus if you put but in there, it sounds like maybe I don't love my kids, which obviously you do. I love my kids, but I need a break. The but negates that first half in a subtle way in our minds that we don't even realize.
Exactly. Let's talk relationship skills. Communication skills, boundaries, recognizing some patterns within relationships. What first comes to mind as far as relationship skills?
Oh my goodness. What I've been using a ton lately, I talk a lot about this kind of continuum from completely protected, completely walled off to completely connected, completely vulnerable, unprotective of ourselves. And how do we find this really tender balance for a lot of people of protected and connected? And it's a spectrum. Like there's a healthy range in the middle. That's something I'm usually introducing anytime I hear relationships and boundary things coming up.
Similar here, I think it's important that we can recognize like what are the challenges in front of us, naming the patterns. In marital relationships, that's oftentimes there's a pursuer and a withdrawer, and both want intimacy, are looking for intimacy, and feel that disconnection. And with that disconnection, the pursuer will try to get closer in ways that are maybe seen or deemed as nagging or criticizing. And so the withdrawer receives that as I'm not enough, and so they continue the withdrawal pattern. And in both cases, defenses are raised, and that creates this infinity loop death cycle, the marital dance, if you will, based on emotionally focused therapy, that can be really a challenge in relationships. And so speaking from using the I statements in not just marital relationships, but in all relationships, using I statements, speaking from our emotion rather than from accusation, giving the benefit of the doubt to people, and perhaps asking verifying or clarifying questions. What did you mean when you said that? Can seem really difficult, really hard at the time, but can be very valuable to gain clarity and perhaps overcome some negative distortions.
Yes. I sometimes also feel like people think any level of, I wouldn't even say conflict, but conversation feels like such big conflict to people. And so I'm often also saying with some lighter topics, like, what if that isn't a big, like, hey, we need to talk conversation? What if that's like a, hey, I've been thinking. And you put some humor in there, you put some lightness in there, you lead with curiosity. Sometimes I feel like there's this conflict feels so threatening that it feels like every tiny conflict feels like this big, sit down, we must talk conversation that is actually probably feels more threatening than it needs to be.
Boundaries is probably a big topic that deserves its own episode. But just, I like the term boundaries, and I would encourage people to check out the book Boundaries by Dr. Henry Cloud that speaks on, I think the best image of like boundaries is not just putting up a moat or a castle wall, but rather it's like putting a picket fence around your house with a gate at the front it's not that people can't come in, but it keeps people from coming in the side window or, like the cellar. It's like, yeah, you can come in, but I, have this expectation that you're going to come through the front gate, knock on the door. And that's kind of creating those kinds of healthy boundaries. Boundaries is not a punishment. It's not a wall. It's not a moat, but rather just a clear expression of what I am responsible for and what I'm not responsible for. We oftentimes have anxiety and all sorts of emotional disturbance because we're assuming responsibilities for things that are not ours.
Yes. I like the focus you put there on the I. Like, what am I responsible for? I'll often tell people boundaries aren't, you can never talk to me that way. Boundaries are, hey, when you talk to me that way, I'm going to take a break from this conversation and come back.
Yeah, I'm willing to talk when we can both speak respectfully to each other.
Mm-hmm.
And that time may or may not come.
Yeah.
There's so much that we can get into. I think even topics such as regulating our nervous system, emotional regulation, which a lot of these skills and tools can be very helpful for emotional regulation. Integrating faith into all this is very important. Even just taking a moment, taking a breath. With that breath, perhaps inviting the Spirit of God into us, and breathing in through our nose. That's, a very simple skill too that I think can often go overlooked is just some breathing exercises. Breathing in through our nose for 4 seconds, holding it for 4 seconds, releasing through our mouth for 4 seconds, and then holding that for 4 seconds. I like to give the imagery, and sometimes we'll lead a session with a meditation that is like a breathing exercise. But as we're breathing, let's breathe in the Spirit of God, that the same breath that God breathed onto the world when He created us, the same breath that Christ breathed onto the apostles and giving us the gift of the Holy Spirit. And as we breathe out, let's breathe out all of that shame, that resentment, that fear, those things that are toxic to us.
Yes, that's beautiful. Yeah, we've hit so much, but also barely hit anything at all in these 30 minutes. I think maybe the closing message is, and as cheesy as it sounds, of like, if you want to learn more, come see us, or go see a counselor somewhere else. There's so much here to dive into, and we've just barely scratched the surface.
Yeah. The goal is not that our clients never struggle again. We're all going to struggle. But rather the goal is that when they do struggle or when we do struggle, that we have tools, support, self-awareness, and hope. I think hope is such a powerful thing, ambiguous indeed. But, hopefully our clients are leaving therapy sessions with a little bit more hope than when they walked in. And that hope can sustain us. So being able to find that hope within us, that can be very powerful.
I hope this left some people with a little bit of hope too.
Yeah.
Awesome.
Well, it was a pleasure diving into this topic with you, Lucy.
Absolutely. You as well, Scott. Hope everyone has a great day, and we'll see you on here another time.
Thanks for listening to this week's episode. To learn more, you can visit our website at fiathealth.org. If you enjoyed this episode and you'd like to help support the podcast, please subscribe to our show on your favorite podcast platform and leave us a review. This helps make the podcast easier to find. Lastly, if you'd like to reach out, ask a question, or suggest a topic for a future show, send us an email at media@fiathealth.org. God bless.